Well, now that the FDA committee has recommended the Pfizer COVID vaccine for children ages 5 to 11, that means 28 million children are now eligible for the vaccine as soon as next week. But parents have a lot of questions, so joining us to give us some answers, Dr. Shikha Jain with UIC. Good morning to you. Nice to see you again.
Good to see you, Sylvia.
Right now, the word is that only about a third of parents actually plan to vaccinate in this age group right away. So I wanted to hit you with a list of questions because there are a lot of questions. So let's start with the basic one that a lot of people keep bringing up, and that is, do young children really even need to get vaccinated considering they are less likely to get seriously ill?
It's a great question. I'm getting asked that by a lot of parents, Sylvia. So first, I want to tell you, almost unanimously, every physician I've talked to who has kids in that age group is waiting to get that shot. They cannot wait, and they've already signed up to get those kids that shot. So it is important to get kids that age vaccinated for COVID. We know that the majority of kids who do get COVID don't end up very ill, but we've seen a huge spike in the number of young children who are getting COVID. And there are some kids who do get very sick, get admitted to the hospital, and can develop severe illness from COVID. So even though it's not the majority of children, we do know that kids are at risk from getting sick. And if we want to keep our schools open, we want kids are safe in-person learning in schools, we really need to make sure that we've got COVID stopped in its tracks. So we need to get our kids vaccinated as soon as possible.
Okay, so let's talk about where these shots will be given, because for adults, we all were trying to find different areas. There were big venues that were set up. Where will parents need to go to get their children vaccinated?
There's a couple of different places that are getting set up as we speak. So I know pediatricians' offices are going to be having the shots in their offices. I know there's a lot of schools that are actually setting up vaccine drives similar to what they did when it was approved for kids 12 and older. We're actually helping set up some vaccine drives through Impact across the state in different schools. We've also heard about some pop-up vaccine events that are going to be happening similar to what we saw again when the 12-year-olds were getting vaccines. And we're hearing schools actually having vaccine events at their schools, which might be a good way to get that community feel and get the kids socializing while they're getting their shots to make them a little bit more comfortable. So I think there's going to be a variety of ways to get these shots into these kids' arms safely.
So what do we know about the side effects when it comes to this age group? Because the shot itself, even though it may be Pfizer, it's not the full amount that we have all received. So when it comes to children and side effects in this age group, what do we know?
So it's similar to what we're seeing in adults, and actually a lot of the kids aren't getting really significant side effects at all. Maybe a little bit of fatigue, some soreness at the shot site, feeling a little bit tired, maybe getting a little bit, more lethargic than usual, maybe not having as much of an appetite. But there are ways to mitigate that as well. You can put warm or cold compresses on the arm, a little bit of Tylenol if your child's able to get Tylenol. So they're really pretty mild, the majority of the side effects that we're seeing in this age group.
Okay, so let's talk about how adults can help prepare their children for vaccinations. I remember taking my kids to the pediatrician and dreading shot day. For a lot of children, this is traumatizing. Some children experience the pain from these vaccines more than others. So what can parents do to help prepare, calm their children before they get these vaccinations?
So as you know, Sylvia, I also have young kids, and my 7-year-old actually went to get her flu shot a couple weeks ago, and she hates shots. She's scared of them. She doesn't like getting them. She got her shot this year, and the next thing she asked the pediatrician was, when can I get my COVID vaccine? And that's because we've been talking about it. So I think a really big thing is communicating with your kids, explaining why the shot is important, and telling them what the process is going to be like. Another thing you can do is you can offer to bring a comfort item with them. So ask them if they want to bring a stuffed animal or a book. Plan something fun or special to do afterwards. Like we went out for a fun lunch, which I don't usually get to do with her. There are ways to distract kids. So ask wherever you're getting your child the shot if they can do something like blow bubbles during the shot. Sometimes you can tell your child to look away or not look away depending on what they want to do. I told my daughter, I don't like looking when I get a shot, so she didn't look either. Just being really supportive and having that open communication. You can even in some situations put a little bit of numbing medicine. So something like hemorrhoid cream can actually numb the area, but some kids don't necessarily like that cool feeling. So if you're going to do that, I would test that out ahead of time. And again, the biggest thing is talking to your child about why this shot is so important, why you want them to get it, and then talking them through the process and making it a comfortable experience for them. You can also offer for them to either sit on your lap or sit next to you, hold your hand, give them some ownership and some responsibility so they feel like they're in control as well.
Okay, you mentioned the cream that I didn't expect you to mention. I thought you were going to say something like lidocaine, like an EMLA, but you're saying we can go and buy this over-the-counter hemorrhoidal cream and that'll provide a little bit of a protection?
So you can actually try it. I've heard some parents who've tried it and it seems to help. But again, don't do it the first time on that day of the shot. Try it maybe a couple of days before to see if it actually does numb the area. There is creams like lidocaine cream and EMLA cream that absolutely works as well. We actually used EMLA cream when we got my daughter's ears pierced and it worked really well. So that's another option. But I know some parents don't really want to go the prescription route or go the lidocaine route. So that's why the hemorrhoidal cream is sometimes a nice alternative.
Interesting. We always learn such great things from you. Okay, Dr. Jain, we want to keep the subject on children. So please stand by. When we come back, we're going to talk some Halloween safety tips. Don't go away.